Okay, so welcome back. So we are talking about the diagram of brachial plexus. So I think you have seen the roots, the trunk, the division, the cord, the branches. So the popular thing they normally used to ask you here is the nerve roots. So let's trace this two. So you see that let's imagine that you have something like you brought a bigger jug, then you now bought Coke and Fanta. You pour inside that bigger jug. What will you have there? It's Coke and Fanta, right? Good. Then you now brought two smaller cups. Pour in cup A, pour in cup B. So what will be in those separate smaller cups? You see Coke and Fanta. So this is the jug. You poured C5 and C6, meaning that upper trunk is C5 and C6. Have you? Then you brought two smaller cups, that is A and B. Then these two smaller cups, if you pour from this jug, it will still be what? What will be here is still be what? C5, C6. C5, C6. Then the same thing here, this one is very simple. You brought one jug, that is a jug, you pour only Coke. So you that middle trunk is C7. Then you brought two smaller cup A and B. What will be here is still C7. Then this one is still what? C7. Then the same thing here, this is the bigger jug where you poured C8 and T1. Then you now share it. It will still be what? C8 T1. C8 T1. Do you understand? Okay. So then let's now ask ourselves, what forms lateral cord? Is it not anterior of upper and anterior of middle? Then what is the nerve root of anterior of upper? Is what? C5, C6. Then what is the nerve root of anterior of middle? Look at this, it's C7 now. So I now see that the nerve root of lateral cord is C5 to C7. So the all the nerves, look at the nerve coming from lateral cord, musculocutaneous nerve, lateral pectoral nerve, lateral root of the nerve. All these nerve, all of them, that is the MLN, all the MLN, all of them have the same nerve root as C5 to C7. Very simple, right? Sharp. Then for the medial cord, let me do medial cord. Remember, what form medial cord? Just anterior of lower trunk, which is what? C8 T1. So all this nerve, that is the 4M, all 4MU, all this nerve, the 4MU plus 1U, all of them have the same nerve root as C8 to T1. But in addition, this guy, radial nerve, have C7 in addition. So it means that radial nerve root is what? So ulnar nerve root is what? C7, C8, and T1. Meaning that the 4M has nerve root as what? C8, T1, but ulnar nerve in addition have C7 in addition. Then for this guy, remember, one form posterior cord is anterior of upper. Look at it. Sorry, posterior of upper. C5, C6. Posterior of upper is C5, C6. Then posterior of middle, which is what? C7. Then posterior of lower, which is C8, T1. So meaning that what? Posterior cord have the same. Posterior cord has what? All the nerve roots from C5 to T1. That's how posterior cord shared this nerve fiber. He gave ULA. I normally call them what? ULA. He gave them C5, C6. Then he gave radial nerve R, all of them, C5, T1, C5 to T1, making it the largest branch of brachial plexus. Then the T now, what is in between C5 and T1 is what? C6 to C8. So this is how to remember all the nerve roots. So let me recap again. It's very simple. For what? All the branches from lateral cord have the same nerve root. Sorry, lateral cord C5, C6, C7. All the branches from posterior cord, all the branches of medial cord have the same nerve root as C8, T1, except one that have C7 in addition. Then for what? If you come to ultra for posterior cord, just know that OLA, that is upper subscapular nerve, lower subscapular nerve, and axillary nerve, circumflex nerve, have C5, C6. The radial nerve have all of them C5 to T1, making the largest. Then being between radial nerve, you know, C5 to T1 is dorsal nerve or middle subscapular nerve, which is C6 to C8. Please, I want you to know that medial cutaneous nerve of arm is the smallest branch of brachial plexus, while radial nerve is the largest branch. I think then the remember I told you that all these branches here are what? Infraclavicular branches. Those branches from the cords. Then remember I told you I can't actually present it in this diagram, but this the branches from the roots. Okay, so those branches, remember why we call this one infraclavicular because remember the cord is located in the axillary. So and axilla, as you can see, axilla, as you can see, is below the clavicle. So it's below the clavicle. So it will be infra. So those branches from the cord will now be all infraclavicular. Then remember the roots and the trunk are seen in the neck. The root is between the neck, between the scalenus anterior and scalenus medius, while the trunk is between is in the posterior triangle of the neck. So you now see that the root and trunk, guys, the neck is above the clavicle. The branches that will come from these two root and trunk will be called what? Supraclavicular branch. Remember, I said the only part of components of the clavicle that didn't give any branches is what? Derivation is exam question. So I'll say DSLS. DSLS. So these three are coming from the roots. These three are coming from the roots. While this one is coming from the trunk. So D means dorsal nerve. S means nerve to S, which is subclavius. Then L means long thoracic nerve. Long thoracic nerve. Some people call it nerve of Bell. You understand? Then this one is suprascapular nerve. Supra, suprascapular nerve. So the for the nerve root is very simple. Just one step forward. This one is C5. This one is C5, C6. This one is C5, C6, C7. Then SS. They have the same nerve root as C5, C6. So the scapular nerve is C5. Nerve to subclavius is C5, C6. Long thoracic nerve or long nerve of Bell is called is C5, C6, C7. Then suprascapular nerve have the same thing, the SS, C5, C6. So I think we are done with it. So you mean that how many branches do we have in total? We have 13 infraclavicular branches and 4 supraclavicular branches. Do you understand? Okay. Then I think the next thing here is for us to actually know what this nerves supplies. Do you understand? What this nerve supplies. Okay. Let me now wipe this. Please, this diagram is very, very simple. Y. Then split each of them into two. Then join the anterior of upper and anterior of middle. Join the three posteriors. The anterior of lower will now form the medial cord. Then split lateral cord, MLL, posterior cord, ultra, medial cord, 4MU. Okay, so we're talking about what? Innervation. Do you understand? Innervation. So innervation. So one thing you notice here is that we have how many branches from brachial plexus? They are actually 17. That is 14, 13 infraclavicular branches and 3 4 supraclavicular branches. So let's start with the DSLS. So the first thing is that let's group these nerves. These nerves are grouped into 3. So we have a sensory nerve. Sensory nerves. There's the one that supply only the skin. We have the motor nerves, the one that supply only the muscles. Then we have mixed nerve, the one that supply both skin and what muscle. Actually, these mixed nerves are called terminal branches of brachial plexus. Terminal branches of brachial plexus. So this guy, they are just two. Then this one is 9. So I mean, the motor one is 9, and this one is 5. Let's check. If you actually check, you see that this is 16. That one I explained. We said it's 17 branches, but we are getting 16 here. Don't worry, you understand. Okay, the one that are purely sensory are just two, which are median cutaneous nerve, median cutaneous nerve of arm. That one I said the smallest branch. Median cutaneous nerve of what? Forearm. So that the two nerves that are purely what? Sensory. Then if you come to the mixed I call them MAM. So the mixed I call them MAM. MAM means musculo. Even from the word musculo, cutaneous nerve. Okay? Then axillary nerve. Remember axillary nerve is also called circumflex nerve, radial nerve. Then median nerve. Please, median nerve is also called labrador's nerve. Then ulnar nerve. Ulnar nerve is also called musician's nerve. So this one is called circumflex because it winds around the surgical neck of humerus. This one is called labrador's nerve because it supplies long flexors of the digits. This one is called musician nerve because it controls the fine movements of the what digits. Okay, so this guy, one thing I want you to know about these muscles that they are mixed, mean they are both what sensory and what motor. Please, I'm not going to talk about the sensory innervation of all this. I'm not going to talk about sensory innervation of this guy. I'm not going to talk about sensory parts of this mixed nerve because when we did cutaneous innervation, I talked about all the sensory supply of the what upper limb. So the only thing that is just left here is what I'll just do the motor part because if you remember, medial cutaneous nerve of hand supply the what when we see it supply skin of lower medial one third. Anteromedial is lower medial one third of the arm. And this one is what median and median aspect of the forearm. So I think I've done it. So even already and if we have explained everything about them just in terms of their sensory supply. So the only thing that is remaining is just their mixed. Sorry, the motor part. So I want you to know that these five muscles pass through muscles. Five nerves pass through muscles. So this one pass through coracobrachialis muscle. This one pass through deltoid. Actually, they used to say that this one passed through two hairs of coracobrachialis. This one is just a pierced deltoid. You say it passed between the two hairs. Then the radial nerve passed between the two hairs of spinatum. Then this guy passed between the two hairs of pronator teres. Then this guy passed between the two hairs of flexor carpi ulnaris. Okay, so let's continue. So then let's talk about since we have grouped the nerve, let's talk about remember I said we are talking about everything about science. Let's focus on the motor. Okay, so let's come here. So D is what? Those are scapular nerve. I've talked about nerve with so it's just the motor supply. So this one is the one that is purely motor. Those are scapular supply. You know, look at. Let me tell you how I remember it. Those are R and S supply rhomboids and levator scapula. Scapulae. So rhomboids, you have rhomboid major and minor. Then D S nerve to subclavius obvious is subclavius. Then L long thoracic nerve is a serratus anterior muscle. This muscle that we call boxing muscle. Okay. Then suprascapular nerve supply supraspinatus and infraspinatus. Then I think we're done with these are the four. So are you saying that all the nerves, all the supraclavicular branches are what? Purely motor. Then if you come to lateral cord is MLL. So MLL. So musculocutaneous nerve, the most we have talked about the sensory part. The motor part is BBC. That is biceps, brachialis, and coracobrachialis. I think we've said this in uh, we said this thing when we did what is it? Continuous innovation. When we say that musculocutaneous affects supply BBC more continuous and what lateral continuous nerve of forearm. Then lateral pectoral nerve supplies both P pectoralis major and pectoralis minor. So I normally say, I think I said that this guy supply more of P minor. Do you understand? You supply more of P minor than P major. Then this lateral root of median, we didn't supply anything. That's why those two. Then lateral, okay, then look at the next one. 4M, then U. Let me call this first one medial root of median nerve. So these two nerves, the median root of median nerve, lateral root of median nerve, and then median root of median, it's just like, okay, let's say, look at how the formation is. This is axillary artery. Let's say towards this side is lateral, and towards this side is the medial part of it.